Good afternoon, everyone. It is noon on the dot, and we're going to get started with this afternoon's session. Thank you very much for joining us. This webinar is Person-Centered Long-Term Care Communities, an intro to CARF Accreditation for family councils. My name is Sam Peck. I am the Executive Director of Family Councils of Ontario, and it's my pleasure to welcome you all. Before we get into today's content, we're going to start with a land acknowledgement. These are important reminders of the land on which we live, work, and care, and an important way to recognize the original inhabitants of the land. Our work, the work of long-term care homes, family councils, family caregivers, community partners, takes place on traditional Indigenous territories across the province we now call Ontario. And our team is really thankful to be able to live, work, learn, and network on this land. First Nations peoples were the original inhabitants of the land that we call Canada. And in fact, in Ontario alone, there are 46 treaties and other agreements that cover the province. I'm coming to you today from Hamilton. And the city of Hamilton is situated upon the traditional territories of the Erie, Wendat, Huron-Wendat, Neutral, Haudenosaunee, and Mississaugas. And it's also land that's covered by the Dish with One Spoon Wampum Belt Covenant. And that was an agreement between the Haudenosaunee and the Anishinaabeg to share and care for the resources around the Great Lakes. Since that time, other settler and Indigenous communities have been invited to participate in that agreement and peacefully share for our resources. This land's also covered by the Between the Lakes Purchase of 1792, which was between the Crown and the Mississaugas of the Credit First Nation. Métis First Nations and Inuit people have cared for these territories since time immemorial, and they continue to live, work, care, and contribute to the strength of long-term care homes and communities across this province. Acknowledging the land is an Indigenous protocol that's used to express gratitude to those who reside here and to honor the Indigenous peoples and communities that live and work on this land historically and presently. And it really gives us an opportunity to appreciate the unique role and relationships each of us has with the land, whether we are descendants of settlers, people brought here against their will, perhaps through the transatlantic slave trade, or Indigenous. And it provides us with a gentle reminder of the broader perspectives that can expand our understanding to really encompass the long-standing rich history of the land and our privileged role in residing here. There's a great website that's native-land.ca, and you can learn more about the people, territories, and languages of the land on which you live, work, and care. So it's part of our commitment to reconciliation. We're continuing to learn as a staff team about shared history, Indigenous presence, land rights, treaties, etc. And we hope that you will join us on our journey towards reconciliation as we just try to do better as people who have the honor to be on this land. Before I turn it over to today's guest speaker, a few logistics. You'll notice you're all in what's called listen-only mode. So you can hear us, but we can't hear you. But we have protected time for an interactive Q&A session. At that time, we'll invite you to use the Q&A box at the bottom of your Zoom screen to pose your questions to the guest speaker. We'll ask that you only use the chat feature if you're having technical issues. Today's session is being recorded and will be available to all of you and to anyone you wish to share it with via our YouTube channel, and it will be published in our weekly e-bulletin. Now, without any further ado, it's my pleasure to introduce today's guest speaker, Jill Allison. Jill has been an accreditation advisor with CARF Canada since 2013. She earned her MBA from the University of Windsor and has an undergraduate degree in health studies from the University of Waterloo. Jill has worked in a range of health settings, including in long-term care, home and community care, health promotion, and primary care. As well, she has worked as a university instructor, primarily teaching business topics. So now, Jill, over to you.
Thanks, Sam. Can you hear me all right? Okay. Hopefully, those of you who have got the video for this will be able to see these slides. I can share those with Sam, and you can share those out later if you would like. So yes, the topic today, person-centered long-term care communities, an introduction to CARF accreditation for family councils. And so today, we'll be looking at an overview of accreditation, including the value of accreditation, some studies, the process to become accredited, and hopefully some samples or examples of standards that might be of special interest to family council, especially those related to input, and also some information about postings to let you know that a survey is coming to a home near you. So I hope you'll find this to be useful. I'm Jill Allison, as Sam mentioned, and I'm joining you from Windsor, Ontario, which is the traditional territory of the Three Fires Confederacy of First Nations. So let's move on to look at information about CARF. The mission of CARF is to promote the quality, value, and optimal outcomes of services through a consultative accreditation process and continuous improvement services that center on enhancing the lives of persons served. So used to be on our letterhead, and still I think on some of our materials, you'll see the phrase enhancing the lives of persons served. That's sort of our raison d'etre. Person-centered standards are key to us, not only in the title, person-centered long-term care communities, but throughout our manual for a range of standards, you'll see person-centered language and person-centered standards. And further to that, CARF's board has identified that the person served shall be the moral owners of CARF. If you're wondering what I'm talking about when I use the term person served, it's kind of a generic term. In long-term care, homes may use the term residents, but in other forms of healthcare settings, the person served might be referred to as clients or patients, depending on the setting you're in. So we like to use generic terminology and largely non-prescriptive terminology as well. So I wanted to start off early in the game with this slide to let you know that, and many of you may already know, that CARF is an accreditation option that is listed in the Quality Attainment Premium Funding Policy in Ontario. Over 40% of Ontario's long-term care homes are CARF accredited. And this policy details the requirements for homes in Ontario, long-term care homes in particular, to qualify for a funding premium. And it has been, I'm not sure if it's been updated recently, but it has been 36 cents per resident bed day, additional funding if a home is accredited by CARF or one other accreditor, and also meets the requirements of that policy. Not all homes are accredited, though. This policy simply provides a funding incentive, but not a requirement to be accredited by CARF or another accreditor named Accreditation Canada. Those are the two accreditors listed in the policy. So let's get into some information about CARF. Just some quick facts. We were founded in 1966, so we've been around for quite a while. By 1969, CARF was surveying organizations in Canada, and currently there are over 8,700 service providers with over 65,000 programs and services that are CARF accredited in 25 countries around the world. We accredit organizations on 5 continents, and those organizations serve more than 13 million people annually. So we're not new and we're not small. We'll go into reasons why we may not be as well known in certain sectors in Canada over the course of this presentation. CARF Canada was incorporated in 2002 to better serve Canadian organizations. And in Canada, over 500 service provider organizations with over 4,900 programs and services are CARF accredited. In British Columbia, CARF is an option for Ministry of Child and Family Development and Community Living BC agencies that meet a funding threshold. And they also have 2 options for accreditation. About 90% of those organizations, we're proud to say, have chosen CARF. CARF is an independent, nonprofit accreditor, and despite our full name, Commission on Accreditation of Rehabilitation Facilities, we've evolved to accredit a wide range of health and human service programs around the world. CARF develops and maintains quality standards for a range of health and human service areas, including aging services, which will be the focus of our presentation today, behavioral health, also known as mental health and addiction services, child and youth services, employment and community services, medical rehabilitation, where we got our start back in 1966, vision rehabilitation, and networks. And we're trying to get the word out in Ontario in particular, as we feel that network standards may be a very good fit for those new Ontario health teams that you may have heard about. I already mentioned the British Columbia accreditation requirement for the Child and Family Development, or Ministry of Children and Family Development and Community Living BC. And I mentioned we're one of 2 options there. CARF and one other group whose name has changed recently. Used to be COA. I'm not sure what it is called now because I keep forgetting the new name. But what I will say is CARF believes in choice and accreditation. We think it's a good idea for organizations to have choice so that they can select the accreditation body that suits them best. There are other places in Canada that were recognized. In British Columbia, for example, Vancouver Coastal Health, Fraser Health, and Interior Health authorities have confirmed that CARF is an accepted option for their contracted long-term care home providers. Similarly, in Alberta, Alberta Health Services is recognized CARF as an accepted accreditation organization for several senior services, as well as community mental health and addiction services. I will focus just a little bit more on that Ontario policy that includes CARF as an option for long-term care homes under their quality attainment premium funding policy. But across Canada, not all services and not all provinces require accreditation for the services that they fund. However, CARF may be used as an option for many organizations that want to seek accreditation voluntarily without a mandate or requirement by the funder. So this slide shows the distribution, if you will, of CARF accredited programs and services across Canada. And I mentioned that there's of course, that acceptance in British Columbia, and that is why the bulk of our CARF accredited programs are based in British Columbia right now, seconded by Ontario. And next, Alberta. But you'll see that there's CARF accredited programs across the country in all provinces. Now, what I should mention is that CARF does not have standards for the full range of acute care hospital services. So we're really not an option for hospitals in Canada, acute care hospital services. And many health authorities operate hospitals. So we would not be an option for them if they wanted to have one accreditor that accredited all of the services that we provide or that they provide. However, as I'll mention in a moment or two, CARF is an excellent option for community-based services like long-term care homes, rather than acute care hospital services. So let's look at some studies that show the benefit of CARF accreditation, particularly in the long-term care sector. The first that I want to talk about was a pilot evaluation conducted in Ontario with 10 long-term care homes, and it was done quite a number of years ago, in around 2007. And this was a study done prior to CARF's acceptance as a second option for long-term care homes in Ontario. The study was called Introducing CARF Accreditation into the Ontario long-term care sector. And the overall results of the evaluation were positive. And it in the report, it notes all 4 objectives of the pilot as outlined in the evaluation framework were completely or substantially met. And as a result of this study, what was then the Ministry of Health and Long-Term Care accepted CARF as a second option in 2008. Flash forward to 2023, and there are 269 CARF accredited person-centered long-term care community provider locations in Ontario. That's a mouthful. And so the person-centered long-term care community standards are really what we call our long-term care home standards. In some jurisdictions, they're called nursing homes. In some provinces, special care homes. In Manitoba, what we call long-term care home is called a personal care home. So again, we try and use generic language. There are, at the time I looked at this on April 12th, there were 311 CARF accredited person-centered long-term care community locations in Canada. Another study you may be interested in is one that was conducted in the United States. It was called The Impact of Voluntary Accreditation on Short-Stay Rehabilitative Measures in U.S. Nursing Homes. The study found that CARF-accredited nursing homes demonstrate better quality with regard to the short-stay quality measures, and concluded that approaches beyond traditional regulation and governmental inspections are necessary to improve the quality of care in nursing homes. I've provided the link here if you'd like to read the full study, and certainly you can contact us if you would like to have that link. The next study I'll talk about is one that CARF conducted. We completed it with secondary data that was posted on the Health Quality Ontario website for 6 performance indicators, 4 in the fiscal period, 4 indicators in the fiscal period 2016-2017, and 6 indicators in the reporting period 2017-18. And they included pain, depression, physical restraint use, falls, pressure ulcers, and antipsychotic medication use. And for all of these indicators, a lower number is better. CARF accredited homes, and you'll see on this chart, CARF accredited homes are in the blue lines on the table, or the blue bars on the table. CARF accredited homes on average performed better on every indicator that I've just mentioned than homes that were not CARF accredited. We did a statistical analysis and found that the differences between CARF accredited homes and the other non-CARF homes were statistically significant for 5 indicators, including antipsychotic medication use, pressure ulcers, physical restraint, depression, and pain. It was not statistically significant for falls. When I mention non-CARF homes, I'm speaking of homes that were either not accredited at all or accredited by a different accreditor. Just last week, we completed a paper on another analysis of data on the long-term care key performance indicators on the Health Quality Ontario website, but this time it was updated to reflect the 2020-2021 reporting period. The findings were similar to the previous analysis that I mentioned for 2016 to 18, in that CARF accredited homes performed better on average on all 6 indicators than homes that were not CARF accredited. However, this time we found that the difference between CARF and non-CARF homes was statistically significant for all of the 6 indicators. We will soon begin to share this paper, and so if you're interested in seeing that, you can get in touch with us. So let's talk about CARF standards for quality in health and human services. And in a few minutes, we'll start looking specifically at standards for person-centered long-term care communities. CARF standards, as I mentioned earlier, are largely non-prescriptive, so you can meet the standards in many different ways. Organizations are unique and may have unique ways of conforming to the standards. Not everything will need to be in writing. Surveyors, when they come out to homes, will gain a lot of information by talking to people and observing, as well as looking at written documentation. The standards have been designed to be achievable, universal, regardless of what province you come from or what country you're in. These standards will be applicable. These are international consensus standards. The standards are designed to be straightforward and practical and relevant. And we hear that from organizations that have gone through CARF's process. They tell us that the standards are highly relevant. The standards are kept current and the manuals updated annually to reflect changes in the field. As I mentioned, CARF standards are well suited to community-based services rather than acute care hospital services. So you won't find CARF accrediting hospitals in Canada. CARF standards are field driven, and by this I mean that the standards are developed with input from persons served, funders, providers, and other experts in the field. Field reviews are conducted to obtain public input on drafted standards. And as I mentioned, CARF standards are considered international consensus standards. Our standards are also person-centered, and you'll see references to person-centered care throughout the manual. And of course, as I mentioned, even in the title of our standards for person-centered long-term care communities. As I mentioned, standards are developed with the active support and input of persons served, providers, and other experts in the field. Standards are updated annually, and comprehensive, the annual reviews are based on feedback that we receive throughout the year, but comprehensive reviews of existing standard sets are conducted as appropriate from time to time. And recently, in light of learnings during the pandemic, we convened what we call an International Standards Advisory Committee to review the standards. And this what we call ISAC, International Standards Advisory Committee, included Canadian representation. We looked at the aging services standards for residential care and again followed that review with a public field review. And as a result, there are significant updates to the standards that are going to be contained and are posted now in our 2023 Aging Services Standards Manual. Now we're going to look at the standards that would be of special interest to family councils for long-term care homes. As you can see within the Aging Services Manual, we have standards for adult day services, assisted living that in Ontario are known as retirement homes, person-centered long-term care communities known as long-term care homes, home and community services known as home care, case management, independent senior living, maybe known as supportive housing or supportive living, and personal support services, which are more non-medical types of supports. But we will focus on person-centered long-term care communities. So within our Aging Services Standards Manual, there are 4 sections of standards. For long-term care communities, these may include about 1,000 applicable standards or standards elements within the different sections of the manual. Section 1 of the manual that would pertain to all CARF accredited organizations are the business practice standards, what we call Aspire to Excellence standards. These are foundational business practice standards. The second section that would apply to long-term care homes are the care process for persons served standards. These would cover areas such as scope of services, entry, transition, assessment, care planning, and so forth. Section 3 includes program-specific standards for each of the aging services programs identified, including those specific to long-term care homes. There are optional standards in Section 4 for dementia care specialty and stroke specialty programs. Those would not necessarily be used by all long-term care homes. There are standards for serving persons with dementia in Section 3. We'll talk about that in a minute. Let's look briefly at what's included in the different sections, and in particular start with the Aspire to Excellent standards, the business practice standards. All long-term care communities would need to conform with these standards except governance, which is optional for all organizations, for all person-centered long-term care organizations, unless a funder required them to be used. But by and large, they are considered optional for boards to use if they wish to be involved in the survey process. So there are standards for what we call the A, assessing the environment, standards related to leadership. The S in Aspire, setting strategy. So this section pertains to strategic planning. The P stands for person served and other stakeholders obtaining input. And I'll show you an example from that standard section. The I, implementing the plan, includes legal requirements, financial planning and management, risk management, health and safety, workforce development and management, technology standards, rights of person served, accessibility. The R, reviewing results, includes performance measurement and management, and the E in Aspire, effecting change, performance improvement. Those are the sections of the business practice standards. Here's an example of what a standard might look like in our Aging Services Standards Manual, or really all of our standards manuals, because the business practice standards are the same in all of our standards manuals. So it reads, Standard 1A2, right near the beginning. A person-centered philosophy is demonstrated by leadership and personnel, guides the service delivery, and is communicated to stakeholders in an understandable manner. We often provide intent statements to our standards to help clarify what we mean. And in many cases, we also provide examples. And as I mentioned, our standards approach is largely non-prescriptive. The examples aren't requirements. They are merely examples to give organizations some ideas about what we mean, but they may demonstrate conformance in another way. In the standard, they mention the term stakeholders, and I just wanted to provide the definition of what a stakeholder is. And to note that stakeholders include families. So you'll see reference to the involvement of stakeholders throughout our manual. And again, with this sample standard from our input section, the standard reads, the organization demonstrates that it obtains input on an ongoing basis from persons served, personnel, and other stakeholders using a variety of mechanisms. And so you may be thinking about at the home that you're connected with, what kind of input is sought? There are many different ways to collect input. We provide in our manuals some examples. They may include these items or not, and there may be some unique ways that organizations seek input from those groups, whether they're surveys or suggestion boxes, from complaint or incident summaries, from their strategic planning or service development, from input forums, advisory groups, or consumer forums like family councils or councils and committees, like residence councils. Also from performance improvement activities. You know, I often think that staff management asking as they chat with folks around the organization is another way of getting input. So there are a variety of ways that input can be sought. Here's another example of a standard from section 1 of our standards manual. And I added this one as I thought, and it's a common question that folks have to ask, well, if these standards fit, you know, organizations in 25 countries, how do you know that there'll be a fit in Ontario or in my locale in Ontario? So this standard helps to demonstrate how these standards are a universal fit, regardless of where an organization is located. The standard reads, the organization demonstrates a process to comply with the following obligations: legal, regulatory, confidentiality, reporting, licensing, contractual, debt covenants, corporate status, rights of persons served, employment practices, and any mandatory employee testing within that jurisdiction. So this is a key standard that shows how the standards are used from province to province and country to country. But do know that organizations meeting CARF standards will normally have to exceed any legislation in their area and regulations by conforming with the standards that are perhaps above and beyond what may be listed in the legislation, but as well need to demonstrate a process to show that they are meeting those legal and regulatory requirements in their area. Also wanted to mention, although I haven't noted the specific language of the standards in section M&M of our manual, which are performance measurement, management, and improvement standards that I mentioned earlier, that I think from a family council point of view, that the performance measurement, management, and improvement standards may be of interest, as they include elements on input from persons served, personnel, and of course, other stakeholders, and speak to the experience of services received and other feedback from the person served and other stakeholders. Section 2 contains the care process standards and is broken into a number of subsections. On this screen, we're showing the Section A standards, the program and service structure section, and some examples of what's included in Section 2A, from scope of services to eligibility, if there are any mobile services, mobile unit services, assessment, screening, restraints, medication management and assistance, and medical records. Section 2B for residential communities obviously also applies to long-term care communities. It includes standards around individual units, safety and security, physical environment, dining, housekeeping, laundry, and other services. Also, Section 2C would apply to long-term care homes if they serve any persons with dementia. And we know that most long-term care homes, if not all, serve at least one person with some level of dementia. So if that's the case, they would need to demonstrate conformance to the standards related to serving persons with dementia. Things like standards around decision-making, assessment, education, therapeutic approach, end-of-life care, competency-based training, and so forth. Section 2D addresses the important area of skin and wound, or skin integrity and wound care. And this section would apply to person-centered long-term care communities. Section 2F standards would apply if an organization provides services using information and communication technologies. So for example, via telepractice or telehealth. In other words, technology that allows you to see, hear, and interact with persons in remote settings. Here's another example, and this is a care process standard in Section 2A that would apply to person-centered long-term care communities. It reads, based on the scope of services, written screenings, assessments are conducted prior to the initiation of services at a frequency that is consistent with the needs of the person served, in responses to changes in care, and in response to changes in preferences of the person served. So again, you see person-centered language woven throughout our standards. Here's another example, the care process standard for residential communities in Section 2B. There are regular meetings between personnel and the person served to discuss issues concerning the living environment. Let's look now at the third group of standards that apply to long-term care communities. Section 3 contains a range of program-specific standards, as I mentioned earlier. So let's take a look at, again, specific to person-centered long-term care communities, some samples. Here's an example from Section 3C. There is identification and celebration of life cycle events that are important and meaningful to persons served, families, support systems, and personnel. I hope that provides a useful overview of the different sections of standards, but again, there are some 1,000 or more standards elements that long-term care homes would need to come into conformance with in order to prepare for a CARF survey of long-term care. So this is just a short glimpse of some standards. So at this point, and I see our time is moving along, I'd like to take you through the process for becoming CARF accredited or maintaining CARF accreditation over time. This slide provides an overview of our consultative accreditation process from the point of initial contact with CARF in step 1 to the self-evaluation stage, where the organization is looking at the standards and determining if they come in conformance or need to do some work. The application process for a survey, which occurs around 3 to 4 months before the organization's survey timeframe. Survey scheduling and team selection, survey team selection that is, to the completion of the accreditation report and an accreditation decision at CARF, and then the ongoing reporting and communication to CARF. During the pandemic, we switched to a time-limited, digitally enabled site survey, a remote survey. Our interest was in ensuring that we were supporting the well-being by not sending people into homes, obviously. We have continued since June of 2020 to have that remote survey process. It's not our ideal way of doing surveys, however, was necessary for the time. We have begun on-site surveys once again, and we'll make those our default way of conducting surveys in the near future. We did, despite this not being our preferred, remote not being our preferred way of conducting surveys, we have been really pleased by an overwhelmingly positive satisfaction rating with that process. A lot of work went into developing a remote process. So we talked about the steps, and I'll just go briefly through each of the steps to preparing for accreditation. It can take 12 to 18 months for an organization to prepare for its first survey. And that in part is because organizations need to demonstrate that they have been living the standard for at least 6 months prior to surveyors coming to their site to do a survey. Now, for organizations that have achieved CARF accreditation, they would need to show during a survey their ongoing conformance from the time of the first survey until the time of resurvey. The organization does receive support from a resource specialist throughout their accreditation journey. They're always there to answer questions, to help guide them in the process, and to provide consultation and interpretation of the standards. And that is a free, if you will, a complimentary support that we provide. I mentioned that organizations preparing for a survey need to conduct a self-evaluation, looking at the standards and determining whether they are in conformance or need to do some work. And during this process, again, they have the support of the resource specialist. Once an organization feels for its first survey that it is prepared to have 6 months of conformance to demonstrate during a survey, it can submit an application and an application fee. For resurvey, the due date for the application corresponds to the accreditation expiration month. The application includes a few documents, including an organizational chart, a performance analysis that is the subject to our section 1N standards, and again must demonstrate 6 months of conformance to the standards if they're new to CARF. There's the invoice process. Then at least 30 days before a survey, CARF notifies the organization of the survey date and the team. So about 30 days before the survey, the organization should know which surveyors have been selected, and what dates they will be there. There are close to 1,500 CARF surveyors that are trained in the consultative approach. And those surveyors may come from any number of countries. There are Canadian surveyors, and there are surveyors obviously from the US, and from other countries as well. About 30 days before the survey, organizations need to post a poster that lets everyone know that an accreditation survey is about to occur. On our website, and I know that this is hard to read, there is actually a tool that you can use, that an organization can use to create a poster in 21 languages. So they would just need to select the language that they want to have the poster in and the dates of their survey. And when they do this, actually, I had a little fun with this. I hadn't seen this before preparing for this presentation. This is a sample of a poster that would need to be posted at least 30 days before. And it shows the dates the survey team will be coming, what they are planning to do, and also notes if you would like to talk to one of the survey team members or want to learn more about CARF International, that you can contact CARF at either by our online form or email, by mail, telephone, or fax. And again, this would need to be conspicuously posted at least 30 days before the survey until after the survey concludes. The surveyors, at least one of the survey team members, usually the survey team coordinator, would approximately 3 weeks before the survey contact the organization, discuss logistics, and answer any questions about the interview scheduling. Surveyors, when they coordinate with the organization, would want to identify roles and positions to interview, including staff, residents, family members, and other stakeholders. Where present, that would normally include the Residents' Council and the Family Council. We would also look to direct requests. So if somebody saw the poster and contacted CARF and said, you know, I have this to say, and I wouldn't mind being interviewed, or I would like to be interviewed by your surveyors when they're on site, then that would be noted as well. And as well, surveyors may take, they love to talk to folks. And so impromptu interviews when they're on site may occur. So if you would like to speak to the surveyors while they're there, or if your family council somehow gets missed from the schedule of interviews, contact the number on the poster, get in touch with us. The on-site survey occurs on the dates that are assigned, and it is a consultative process to assess conformance with those applicable standards. And there's a number of ways that the surveyors will determine conformance: through observation of tours and observing services, through interviews with person served staff and other stakeholders, and reviewing documentation. There is a orientation conference before the survey or at the beginning of the survey, and there is an exit conference at the end of the conference. Now, organizations can invite whomever they wish to the orientation and/or exit conference. So if you have an interest, please discuss this with your home's contact person. Within 6 to 8 weeks, CARF would complete and provide a report to the organization 6 to 8 weeks after the on-site survey, rendering an accreditation decision. There are different possible accreditation outcomes. The maximum accreditation decision for long-term care communities in the Aging Services Manual is 3 years. And most organizations do receive a 3-year decision. A 3-year decision would mean that after the award is provided, the decision is made, they would not have another survey for 3 years. A 1-year decision is a possibility for organizations, less common. And it's for organizations that are meeting our accreditation conditions and meeting many of the standards. However, we wouldn't say that they're in substantial conformance to the standards, and there is significant areas for improvement and evidence that we think they can improve to become in substantial conformance within a year. There's a second 1-year decision possibility called provisional. Organizations, though, if we came out, if they had received a 1-year and then a provisional or second 1-year decision, and we came out a third time and they still weren't in substantial conformance with standards, they would move to non-accreditation. Organizations really need to strive to be at a 3-year level. There is the potential for a non-accreditation as well. And it would result when the organization has major areas for improvement in several areas of the standards, or there are serious questions about the benefits of services or the health, welfare, or safety of those served, or the organization has failed over time to bring itself into substantial conformance with the standards. As I mentioned, if they had a 1-year, then a provisional, and they're still not operating in substantial conformance. Or if the organization has failed to satisfy one or more of our accreditation decisions. After the survey is completed, organizations need to submit a quality improvement plan addressing recommendations found in the accreditation report within 90 days of receiving the accreditation decision. It is very rare to have no recommendations. Most organizations do receive recommendations in their accreditation report. This is a quality improvement process. For organizations that receive the maximum award of 3 years, an annual conformance to quality report, or what we call an ACQR, must be submitted annually on the anniversary date. Through the ACQR, the organization certifies that it at all times conforms to the standards, satisfies the accreditation conditions, and complies with CARF's policies and procedures as changes are published and made effective from time to time. As I mentioned, our standards manuals are updated annually. And then there's ongoing communication and reporting. If in particular there are changes or significant events that occur at the organization. There are resources and supports to help organizations prepare for and maintain accreditation as well. I also wanted to provide a word about submitting feedback. This is an excerpt that you'll see on our website, and it is in the section to contact us for providing input. So if you wanted to submit feedback or had a complaint or wanted to resolve a complaint, there is a contact form, and there are different ways that you can contact us about CARF accredited organizations. organization that you wanted to provide feedback or had a concern about. We do encourage individuals who have a concern to first tell a staff member at the organization who could potentially help them resolve the matter. So, a lot of information at this time. I want to thank you for your interest in CARF accreditation. Certainly, you can get in touch with me if you have any questions, particularly about the standards or any other information that I've missed. And I have time for some questions.
Excellent. Thank you so much, Jill, for that. It's a fantastic overview. We do have some questions that have come in. So we'll start with perhaps the simpler to answer one. You mentioned a premium or an extra funding amount for accredited homes. Can you repeat that information for us?
Absolutely. In Ontario, there is what's called a quality attainment premium funding policy. It is Ministry of Long-Term Care policy that, and I believe it was updated in 2020. So if you search for that online, you should be able to find it. And what it includes is, or what it describes is the requirements for long-term care homes to meet in order to qualify to receive an extra 36 cents per resident bed day. And one of the requirements is to be accredited by one of the two recognized accreditors. One is CARF and the other is Accreditation Canada.
Great.
The amount may change from time to time. Last I heard it was 36 cents per resident that day.
Okay, great. So if someone can find their long-term care home on the CARF website, that lists their accreditation status as well. So it might say accredited 3 years when it expires and so on, so people can find that information.
Wow, I can't believe I forgot to mention that. On our website, at the upper right-hand corner is a little red box that says, find a provider or find an accredited provider. And you could use an advanced search. Click on the red box. There is an advanced search option where you can put in the province, and you can put in the program type, which is person-centered long-term care community, and search, and you'll see all of those 269 locations come up. Or in the basic search, you can type in the name of the organization of the home to determine whether it's CARF accredited. That can be a little tricky because if you haven't got the exact name but you should, yeah, it should be helpful in finding that.
Okay, so a few questions about standards within the program. So the first is, are there any standards related to culturally specific or affirming care for culturally specific homes or more diverse homes?
I might have mentioned earlier that CARF standards you'll likely find go above and beyond what legislation requires. And one of the examples I like to use is our standards related to cultural competency and diversity planning. Beyond practicing in a way that respects cultural competency and diversity, organizations need to have a written plan, meaning that there needs to be action, there needs to be work done around that. So yes.
Okay. So what about for dignity in dying or dignity after dying and infection prevention and control for shared rooms? Do those things appear in the process as well?
There are standards around, certainly around infection prevention and control. There are standards around, which was the first one was
Dignity in dying.
dignity in dying. So we do have standards around end of life care, grieving. So there, and I'm afraid I can't specifically quote any of them because there are about 1,000+ standards, but I would certainly be happy to share further information about the language in those standards. And I will say further, and I've probably said to you in the past, Sam, we welcome feedback. As I mentioned, we update our standards manuals annually, and that's based on feedback. So when there are a group of interested folks that want to provide feedback or input on our standards, we want to hear it. We welcome that.
Great. So I still have a few more questions, if you don't mind if we go a couple minutes over. Are the standards published? Can people look them up, or are they kept confidential?
Oh, that's a very good question. So our standards are available for purchase on our website. That is one of the ways that we are a not-for-profit and we are independent, but that is one of the ways that we fund the work that we do. Mm-hmm. Having said that, I am happy to share a complimentary manual with Family Councils of Ontario. And if you're with a CARF accredited home, they should have the standards there because they are working from them. If you are not with a CARF accredited home and want to have a sample copy of the standards, please get in touch with me. And we may be able to do something there.
So a few questions.
Normally you do have to purchase them.
Yeah, I understand.
Yeah.
So there's a few so for the process, so someone's saying they're looking at their home's website. Accreditation is through December 31st of this year. So when would the process begin? So including posting of the notices.
So you might not be able to answer that. Is this a resurvey or an initial survey? Just
Let's say for either.
For either. So for a first-time organization, again, 12 to 18 months is a minimum amount of time they would need to prepare, I think, for a first survey. It would be very hard to prepare in just 6 months. So maybe a year in advance. Long-term care homes in Ontario may find that because there's so much regulation and legislation, it aligns with our standards as well, but there are additional pieces that they would need to come into conformance with to meet our standards. They would probably need a year to prepare. As I said, at least a month before the survey. So they would need to, or they would be getting notice from CARF as to which surveyors were coming and which dates they would be coming. Organizations who are already CARF accredited would need to continue to be working towards CARF accredited, maintaining their CARF conformance throughout that whole period of time that they've been accredited. I'm not sure if that answers the question.
Yeah. So a follow-up question.
Oh, go ahead.
To that is, if you have, let's say, multiple homes within a chain or under common management, is each individual home accredited separately, or do you look at groups of organizations?
Wow, that is a great question. And how do I answer it? Okay, so there is the potential for a chain of homes to put in one application for multiple sites. So that is a potential. There's also the potential for a chain to put in applications individually for each home, and there are pros and cons for doing that. So you may see on our website when you're searching for homes, the name of a location, which is the home name. And in another column, you might see the name of the chain or the parent company, if there are many. So I'm not sure if I've answered that question.
Yeah, absolutely. Going back to the legislation and the compliance with that, does CARF review the ministry's inspection reports of the home as part of the accreditation process?
Oh, that's a really good question that I would normally refer to our resource specialist. So I would have to get back to you on that.
Okay, perhaps we can follow up. All right, I'm gonna just do a few more questions just in the interest of time. So a quick question, is there a fee to be accredited? Does a home pay an application or an accreditation fee?
Yes, and I wasn't sure if you'd be interested in that, so I left that slide out. Yes, the way that CARF charges for a survey is to charge an application fee. Again, it's due about 3 to 4 months before the survey timeframe. And then we charge basically what's a per diem that depends on the number of surveyor days that are required to conduct a survey. For your average long-term care home that is standalone, a single program, one location, it would take 2 surveyors 2 days to conduct a survey. So we would multiply that 2 times 2, which is 4, by a surveyor per diem, which is currently at $2,270 for the on-site survey. I think I've got that right. Apologies if I'm off a little bit. That's for the on-site. It's a little bit different currently for the remote, less, that is, for the remote process. So the average 4-day, that is 2 people on site for 2-day survey, runs about $10,400-ish per survey, plus taxes, plus manuals. As I mentioned, we do charge for the manuals. And that would be per survey. So if the organization received a 3-year decision, they would pay the survey fees at the beginning, before their first survey, and then not again for 3 years if they receive that maximum decision of 3 years. Maybe too much information, but.
Any thoughts on how your standards compare to the new federal standards for long-term care that have been published by CSA and Health Standards Organization?
Okay, so CARF Canada is conducting our own internal work in response to the national standards. And if you would like more information about that, I can provide a contact for anybody who would like to. Our chief accreditation advisor is happy to take questions about that.
Great. So in the interest of time, I'm going to wrap up with a couple related questions. So one, they really get to the question of what's the impact of accreditation or just the connection between a home, passing accreditation or being accredited on, let's say, homes having training on, say, gender persuasive approach or something that's in the accreditation process that really isn't action or something that's done repeatedly. Not, do you have a process or a policy about this? Because council members say they understand the benefit and really the necessity for operators to have policies in place related to the standards, but people are really more interested in the implementation of each one. So there isn't a disconnect in basic policies like making sure that all staff are trained on X, Y, and Z, and that actually being something that's done regularly. So do you sort of so if does accreditation, and you mentioned accreditation having an impact on home performance on indicators. So do you see that being accredited in something really leads to staff performing at a standard of excellence day in and day out, not just doing it because they're being accredited?
That's a fantastic question. And I don't have an absolute answer for it. The studies, we're really obviously pleased to see the outcomes, and that's you know, they're specific to long-term care and specific to the 6 indicators that I mentioned. What I will mention, and I don't think that this is a full, or I'm not sure if this gets to the question entirely, but some will say that CARF isn't an entirely paper-based process. Yes, there are certain things that we need to see in writing, and actually we have a section in our manual called required written documentation, and having policy and procedure for a number of things is important. But as I mentioned, the survey will include observation, interviews of all different participants, or different types of participants, I should say, persons served, personnel, other stakeholders. And so the interviews and the observation takes it beyond, you know, just what's in writing. It needs to be lived. There is as well that annual conformance to quality report where organizations need to attest that they are continuing to live the standards. So again, not perhaps a fulsome, but yeah, I think the studies are also very interesting in terms of demonstrating some outcomes.
Okay, perhaps as a closing remark, if you could just remind people how family council members can be involved in the process, if they need to go through their administrator or to connect with the surveyor directly, and if there's a maximum number of family council members who could participate, just people watching live or recorded, here's how you can engage in the process.
You know, I think that you were quite correct to say, you know, talk to the organization, your contact at the organization about your interest in being involved in the process. As I say, we do put the poster up, but family councils are normally one of the groups, if one exists in that organization, that the surveyors would want to be able to meet with. But in the case where potentially it gets missed, you know, talk to your administration. You can as well reach out to CARF. That poster will be posted. And so if somehow you individually want to get involved, please note that there is a poster that should be posted. And if you don't see it, you know, talk to the administrator. So those are a couple of key ways. And again, in between surveys, there is that piece of our website that talks about submitting feedback and resolving concerns.
Great. So we've gone a little bit over time, but I think that's just because people are so interested in this topic. So Jill, thank you so much on behalf of FCO, the attendees live, and those who may be watching this session at a later date. I know you put your email address, so we will ensure that folks are able to connect with you for any questions that we weren't able to get to or any thoughts down the road.
That'd be great. Thank you.
So thanks again to Jill Allison of CARF for this session, really explaining how their accreditation process works and how you, as family council members, can be involved. Check out the CARF website for more information, and stay tuned with FCO's work by checking out our website, www.fco.ngo. And until we chat again, take care, stay safe, and be well. Thanks, everyone.